This is certainly an excoriating investigation that the Sunday Times has published about the World Health Organization, accusing it of having come under undue Chinese pressure over a number of years preceding the outbreak of COVID-19. In particular, the newspaper has said that China has put in place leadership of the WHO, which would stop it being critical of how it handled pandemics after the WHO exposed China's cover-up of the extent of the SARS outbreak in 2003. They say that China then put in place Margaret Chan, who would really do their bidding. And then following that, they introduced a FIFA-style secret ballot voting system, which meant that smaller countries would have the same weighting in their votes as bigger countries, and it would all be done secretly so that China could use its financial and diplomatic clout to influence those countries in the future. And then from there on, they say that there was a cover-up of the early evidence of human-to-human transmissibility of the COVID-19 virus because China put pressure on the WHO not to stop flights in and out of China early on during the pandemic, which the newspaper then says could, of course, have spread it across the world more than was necessary.
Certainly shocking revelations. Yeah, Jonathan, is there a suggestion that the world could have been spared the current chaos had the Health Organization acted differently?
Well, that does indeed seem to be the suggestion because, of course, the key to all of this was time at the beginning, when it was clear that there was a new pneumonia-like virus that was going round, and Taiwan alerted the WHO to the thing it had seen in the Chinese media, which was that the individual patients were being kept in isolation from other patients. They said that could only point to human transmission fears, but China denied that was a problem, and therefore the WHO didn't act swiftly enough, it seems, from this investigation in order to stop the virus from escaping from China. And then, of course, the first reported case outside China was in Thailand, and the WHO still didn't put in place the necessary level of alert to stop this spreading further still. And the rest, as they say, is history that we're all sadly still living through.
And talking of exactly that, a history that the world is still living through, what is the reaction so far to this investigation? Surely there is going to be some level of outcry globally.
Well, it's interesting because, of course, one of the earliest suggesters in the mainstream of the idea of this having been leaked from a laboratory in Wuhan was, of course, Donald Trump. But because of his controversial nature, it seems that many in the world were very reluctant to even investigate that possibility. But that has really become a mainstream line of argument now. It seems that many people around the world, even at high level, think that that could well have been where this virus came from. And certainly beyond that, there seems to be the suggestion that the investigation by the WHO in Wuhan, when they were finally allowed in, was also influenced by China, with more than 50% of the investigators being Chinese, and therefore presumably under some pressure from the Chinese Communist Party not to suggest that that line of investigation was worth following. And the WHO indeed said that it wasn't worth following, and that they preferred to keep investigating the idea of this having crossed over naturally from animals, either in a wet food market or in a frozen food from abroad, as China at one point suggested. And that means that really there is now a growing reluctance to trust China, and a fear that China is influencing international bodies like the WHO at the potential risk of the world's health, something, of course, that China says is not fair. They say that the WHO, they say that they didn't influence the WHO, and the WHO says its top priority is ending the acute stage of the COVID-19 pandemic, and they are therefore supporting countries to implement comprehensive evidence-based responses, including vaccines.